Ultra-fresh drops are used to relieve dry, irritated eyes caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. This product contains ingredients like carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. These ingredients help to keep the eye moist, protect the eye from injury and infection, and reduce symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. It is recommended to use ultra-fresh drops according to the daily dosage prescribed by your healthcare provider. The optimal timing for using these drops may vary, but it is generally suggested to use them as needed throughout the day to provide relief for dry, irritated eyes. When using ultra-fresh drops, make sure to follow the instructions on the package. If you have any questions, consult your doctor or pharmacist. Do not use the solution if it has changed color or appears cloudy, but don't worry if it has a milky appearance, as long as the color hasn't changed. Some eye drops may need to be shaken before use, so always check the label. Usually, you can use the drops as often as needed, while ointments are typically used 1 to 2 times daily. If using an ointment once a day, it may be best to use it at bedtime. To apply the eye ointment/drops/gels, wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. Tilt your head back, look up, and pull down the lower eyelid to create a pouch. Then apply the drops/gels or ointment as directed, being careful to prevent the medication from draining away from the eye. If you wear contact lenses, you may need to remove them before using most kinds of eye lubricants, but some types can be used while wearing contact lenses. Always check the package. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications, and always use the eye drops before eye ointments. If your condition lasts or gets worse after 3 days, be sure to tell your doctor. When you first start using ultra-fresh drops, you may experience temporary blurred vision and some minor burning, stinging, or irritation. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience any serious side effects. However, if you do notice any serious side effects such as eye pain, changes in vision, or continued redness and irritation in the eyes, it's crucial to inform your doctor immediately. In rare cases, a very serious allergic reaction may occur. Seek medical help right away if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects that are not mentioned here, it's best to consult your doctor or pharmacist. As for the best time to use ultra-fresh drops, it's typically recommended to follow the dosage instructions provided by your doctor. If you have any concerns about the medication side effects or usage, don't hesitate to reach out to your healthcare provider for guidance. Before using ultra-fresh drops, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of the ingredients in the drops. It's important to talk to your pharmacist for more details about the inactive ingredients in the product. If you have any health issues, it's best to consult your doctor or pharmacist before using ultra-fresh drops to ensure it's safe for you. After applying the drops, you may experience temporary blurred vision, so it's important to avoid driving, using machinery, or any activity that requires clear vision until your vision has returned to normal. Before using ultra-fresh drops, it's important to be aware of potential drug interactions. Certain medications may interact with ultra-fresh drops, affecting how they work or increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without first consulting your doctor for approval. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help. In the United States, you can contact your local poison control center at 1-800-222-1222. In Canada, residents can reach out to their provincial poison control centre for assistance. Remember, it's crucial to seek help if someone has taken too much of this medication. When using ultra-fresh drops, it's important to be aware that some products may contain preservatives that could harm contact lenses or cause irritation for people with allergies. Be sure to check the product package for more information, or speak with your healthcare professional if you have any concerns. It's also recommended to use the drops according to the recommended daily dosage and at the optimal timing to ensure the best results. This medication is typically used on an as-needed basis. When using ultra-fresh drops, always refer to the storage information on the package. It's important to protect the drops from freezing. If your drops come in single-use vials or droppers, make sure to discard them immediately after use or within 12 hours of opening. Check the product package for specific instructions on discarding preservative-free drops. If you have any questions about storage, don't hesitate to ask your pharmacist. Remember to keep all medications, including ultra-fresh drops, out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the drops when they are expired or no longer needed. If you're unsure about how to dispose of the drops, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.